So firstly, thank you very much for the opportunity to come out and meet with all of you. And I see that all of you are substantially younger than I am, so that gives me a great deal of energy. So thank you very much. So the reason why happened, this is something that I thought about for many years. And really, the idea crystallized over a period of many years when I was sitting and thinking about health in general. So, how many of you have had experiences during the COVID pandemic? Just, okay. So some of you know of family members who were affected, friends who were affected. And how did that make you feel?
Oh my God, my own mother is affected, so it's a very starting this one. But I am in the other place where I could not come further, and I'm not even allowed to cross that border. And what to do, I don't know. But by God's grace, she was admitted in the hospital and she was taken care, and now she is still perfectly fine. That was really
So I chose COVID as a rather vivid example of how important health can be in your own lives, right? I mean, health is something that we take for granted until it's taken away from us. And without health, life becomes very difficult. So the first thing, our vision is a purposeful life with autonomy and dignity for all. Now when I say for all, I mean for all. That's humans, that's animals, that's plants, the environment, all put together, because we live in a continuum. This is one health and one planet. Lokaha samastaha sukhino bhavantu. In all of creation, let there be bliss and tranquility. So what is health? I can't describe it, but I know what it is like, right? So it's a definition that has been used for some rather unsavory things also. So I don't want to go there. But the conventional definition of health that the WHO chose was the absence of disease, right? Physical disease, mental disease, emotional disease, things like that. But is that a good definition? So I want you to think about yet another definition of health, which is what we call the Mykert model. Can you go to the next slide? Go on. Next slide. Next slide. Next slide. Okay, so this is the Mykert model. What the Mykert model says is that every person who's born had some inborn attributes that you have at birth, right? You're either born a healthy child or not necessarily a healthy child because you have an congenital abnormality, a problem with the heart, a problem with the lung, can be many different things, whatever it is. When you are born, you have some inborn attributes. And as you grow older, you acquire more attributes. These are better physical strength because of nutrition. You are growing in size and strength, but because of the love and nurture of their parents, the family, you're growing in other dimensions. By the time you have grown up, you have all of these attributes that are a product of the attributes that are present at birth the attributes that are acquired, and some of these attributes have been modified by your interactions with the entire environment. Other people, other animals, other plants, whatever it is, social stress. Now, any individual or family or a community, if they are able to, with the attributes that they have, the attributes at birth, the attributes that they have acquired, if they are able to meet the demands of their life, then they are at what we call health ease. The converse of that is dis-ease, actually disease. So that's the microch model. So this is a very different model from the WHO definition, which says that you should have an absence of physical or emotional or other abnormalities. The problem with that approach is that it doesn't apply. You can be a perfect specimen of health, physically, emotionally, in every which way, and yet you are unable to meet the demands of your life. And we know that happens because of the number of people, beautiful people that we know have committed suicide. They were unable to meet the demands of their life. You didn't even know that they had a problem until they committed suicide. So that's the problem with the existing definition, which is why I prefer the microch model, which is very different. So I will give you my own personal example, and I do this very often to a lot of people that makes them very uncomfortable. So if I offend you, my apologies. I stand up in front of a crowd and I ask them, I have given you the WHO definition of health. Tell me, am I healthy? I'm a paraplegic and I use crutches and braces to walk. So how many of you would consider me healthy? A few of you, but not unanimously. But if I applied the microch model, I became paraplegic at the age of 2 because of poliomyelitis. But then I did go to school, I successfully completed my medical education, became a physician. I have a family, I'm a grandfather. So I'm quite able to meet the demands of my life, and I'm sitting here in front of you. So according to the microch model, I'm at health ease because I can meet the purpose of my life. I have autonomy, I have dignity. So I want you to remember the microch model. The next thing that we'll talk about, let's go back a slide. Okay, salutogenesis. So what is salutogenesis? So I need to tell you a little story about Aaron Antonovsky. Aaron Antonovsky was an Israeli medical psychologist, and he studied women who had survived the Nazi concentration camps at Dachau and all of these other places. So you can imagine how traumatic that experience would be for any child, and more particularly for a girl, and how she would develop and grow up to be a successful woman. So our priority, Antonovsky went on with a presumption that these women, so scarred by their experiences in the Nazi concentration camps, would be completely unable to meet the demands of their life. What he really found is that 30% of these women were spectacularly successful. So the question was, what's the difference? What made these 30% of women, despite the incredible trauma that they suffered, spectacularly successful? And he came up with this concept of coherence. What coherence requires is that all of these women had very good insight into who they were. I know who I am. I know the purpose of my life. I can work towards the purpose of my life. So they had very good insight into themselves. So they had what we call comprehension. Second, they had the capacity to cope with whatever life threw at them because of the support of their family, their friends, the environment, their education. So they had capacity. This he called the generalized risk resources. And thirdly, because of that insight, comprehension, capacity, they had the capability to meet the demands of their life. Any kind of activity that actually promotes good health is what we ought to focus on. So Aaron Antonovsky said, rather than focus on all of the causes of bad health or the absence of good health, let us focus now on all of the attributes that contribute to good health. And therefore, salutogenesis. Salute means health, genesis means the formation of. Now this is very different from the paradigm of pathogenesis, where we are trying to figure out what went wrong and then fix what is wrong. It's analogous to taking a look at a machine, asking what component of the machine is malfunctioning that needs to be repaired or replaced. And that kind of paradigm, that kind of thinking is what dehumanizes people. It not only dehumanizes people, it dehumanizes everything. Animals, the environment, and everything. I am an Advaita Vedanti and I see the Brahman everywhere. I also understand that the consequences of my action will be with me for the rest of my life, and also for every life thereafter. That means that every single avatar of mine, I will go with my karma. I will not escape. So that brings me to yet another concept, which is power is an illusion, authority is a delusion, responsibility is reality. So when I first came to India about 25 odd years ago, after finishing my training in the United States, I wanted to do something in India that would contribute to people's good health. And the first question my friends asked me is, how much money do you have? And I said, I don't have any money. I was still in training, so I had just enough to be reasonably comfortable. So how much power do you have? Which minister do you know? And so on and so forth. And I said, I don't know. More importantly, they don't know who I am. So there's no way I can exert influence and power over anything. But I do know my responsibility. I do know that I must do what I can, so I will come to India and start. And that's what I did. So I got together with a bunch of my friends and we said, look, the most pressing problem I as an infectious disease clinician can contribute to is the HIV pandemic. So we start by getting a bunch of people together, training them how to recognize HIV, how to diagnose HIV, and then how to manage those patients. This is long before the antiretroviral therapy, the drugs that now make HIV a treatable condition were available. In those days, HIV was a death sentence. People typically lived for approximately a year after diagnosis and died. So you started out there. But that's precisely the point, that if you feel responsible, then you get together. The first thing you do is bear witness. You don't have to do anything other than bear witness, which means recognize what's going on around you, record it faithfully, and report it with fidelity. That's called bearing witness. Tell the whole world what's going on, because that changes the environment. Once people know what is going on, then maybe some of the people start thinking about, what can I do to make a change for the better? So that's called bearing witness. The second thing you do is you network. You network with other people, because no individual can do anything more than just 24 hours a day, 7 days a week, 365 days a year. But if when you network, then you are multiplying your capability and your ability to produce. So now you have transformed I to the power of V, an exponential increase in capability. So I networked. I got together with a bunch of my friends and colleagues, and we started the program for HIV. We wrote, we asked for funding, and since the last 20 odd years, I and my entire group that I recruited, trained, and mentored have spent over 400 crores in India to support the government of India, the National AIDS Control Organization, National Tuberculosis Elimination Program, the state governments, health departments to do this work. It all started with a very simple commitment. I am responsible and I will start. Nothing is easy. It's extraordinarily difficult. There are many, many, many heartbreaks along the way. There are many times that I sat down and cried. There are many times that I banged my head and I said, what on earth? How can people not understand or help? Now coming to the happen paradigm. Happen simply means that health advancement, peer partners, empowerment network requires that individuals and individuals as constituent members of a family, families as constituent members of the community must be helped to take ownership of their own health. If they take ownership of their own health, then they will do all of the things that will lead to a purposeful life with autonomy and dignity. But they must understand, I am responsible for my hypertension, my diabetes, so I must have a good diet, I must have good exercise, I must have good sleep. But I can do it better if my entire family supports me. It's very difficult to tell a person that you must change your diet when the entire family is eating something totally different. The entire family's diet has to change. The entire family's lifestyle has to change. One does not have the ability to quit smoking when everybody around you is smoking. One does not have the ability to quit drinking when everybody around you is drunk all the time. So it takes an effort. It takes a family, it takes a community, it takes networking, and it takes peers to help peers. So that is why peer partners. So if you network and you empower people to say, I, along with the rest of my family and friends and other peers, we are all going to get together to ask the questions that need to be asked, to come up with potential solutions that we will try out and see if they will work or not work. Then you have happening. And that's the entire idea behind it. So we chose an area in Hyderabad which is called Walker Town, primarily because it's a mixed neighborhood. It's mostly middle class, some lower middle class, but also a lot of slums in there. So it's a mixed neighborhood, and that's where we started. We've recruited over 500 people now. I believe today the number is 580. And the way we started is we first went out to just get to know people. Can I have the privilege of working with you, knowing you? Can I have your permission to see what your blood pressure is doing, what your blood sugars are doing? Can I have your permission to talk to you about how you can get control of your blood pressure if it is high, get control of your health and diabetes if your blood sugars are high? What kind of services can you access? The government has Basti Dawakhanas, the government has so many other services available. How can I help you tap into those services? But then, how can all of you help us deal with some of the problems that we think should be dealt with in the community? There are dogs, there are feral dogs in the community. They constitute two different risks. They physically attack vulnerable children and older people, and their bites can transmit rabies, which is a fatal illness. 95% of the rabies in India is feral dogs, and those dogs are not immunized against rabies. How can we work on that? How can we work on eliminating contamination of the entire living environment with plastic litter, which is non-biodegradable? And microplastics are a big health hazard. Now, do we really need to get involved with HAPPEN? I would ask you, if I would ask you that each one of you go home and ask yourself, what can I do with my own family to address hypertension and diabetes? Let's start there. All right, thank you very much.
Let's give a huge round of applause to Mr. Vijay. I think we could keep listening and continue, but I want to let the others also have little time to present. But thank you so much for sharing, Vijay sir. Really appreciate it.
Do we have more slides? Maybe the last slide with the contact info on the website.
Yeah.
So there's a last. Yeah, just can you show the last? Oh no, I think maybe I just got it all out. Anyway,
But yeah, we'll share
it.
it. Yeah, we'll share it in the WhatsApp group later after the call too. And yeah, we have time afterwards also for networking. All right. Thank you so much, sir.